Welcome back, everyone. This is part 2 of the Chris Rock Hard Callus. Now, a lot of people in the comments were like, hey, great job on the callus, but we'd like to see those nails. And I was kind of waiting to see if people wanted to see it, so here we are. Now, I was hoping to make a follow-up video with that patient doing wound care. Unfortunately, he didn't show up. And a lot of times these patients don't show up. It's either they just don't care about their feet, or they don't have a ride to the clinic, or they just wait until it hits the fan and it's really bad. And what I mean by that is, keep in mind, a lot of these patients being diabetic, they can't feel their feet. So they'll get a wound or an ulcer, don't even know it's there, and then one day they got fevers and chills and all this, these systemic signs of infection. And at that point, you're in really big trouble. Unfortunately, there's nothing I can really do except call the patient and try to remind them. But anyway, here's the video on the nails. I hope you enjoy. I hate this. 2022 and still. All right, so we'll get these. Cut this toenail here. This is usually just, these come off in layers usually, like that, so. Just take it off piece by piece. You don't necessarily want to get it all off in one bite, because sometimes the skin mingles in with the nail here and can cause some problems, like just bleeding. You can hear how hard those are. Keep my finger over it to prevent it from shooting. You can tell when it's going to shoot. Okay, so what I'm going to do now is smoothen it with the Dremel. Actually, we'll cut the rest of them while we're here. Nice and crunchy. Oh, this one's a doozy. Came off easy though. And this last little piggy here, and voila. We'll smoothen these with the Dremel. Now remember, nail care isn't always a covered service by podiatrists. Just because you're diabetic doesn't automatically mean that you get your nails clipped. And just because the nails are long doesn't mean it's automatic nail clipping. We have to have two things going on. Number one, we have to have pain. If we don't have pain, which we don't typically with diabetics with neuropathy, then we resort to something called class findings. What are class findings, you ask? Well, class findings are certain qualifying factors that the patient must have in order to get it covered by insurance, making them high risk. What are some of those factors? Some will include maybe absent foot pulses, decreased hair growth with swelling and varicose veins, absent sensation. There's an entire list that we have to go by in order to check mark it and get it covered for the patient. All right, so our goals with this is no sharp corners, nails aren't digging into the adjacent toes. You don't have to get every single nook and cranny here. You just want them, this is more than enough for the patient to be very happy with them. Any pain or anything with these?
No.
All right.
I was worried about that big toe, but...
Let me clean out between the spaces here. So while we're at it, just do a complete job here. Clean out in between your toes.
I'd rather not look. I know I get real
Squeamish.
Even my parents used to call me nails. And the kid like, no! They would dig in.
I remember digging out, my mom digging out splinters. Those were the worst.
Oh, yeah.
It's like no anesthesia.
Oh, it hurt. Daddy cleaning all my ears.
Yeah, I don't remember that one too often. A couple times. Then it's like we find out Q-tips. You're not supposed to use a Q-tip.
Yeah, I know. I didn't find out until later. I've been using them my whole life.
Oh yeah, you know what? I still use them even though
They're fair enough.
Yeah, I'm just like, as long as you're not pushing it all the way in, I guess, you know? Like I just get the outer area. I mean, who doesn't want clean ears?
Oh, I do. It's irritating. It's not.
It is. Alright, we'll Dremel these down. This one's a lot easier than that other foot.
Oh yeah.
Now remember the goal of nail care. It's to prevent ulceration and prevent high-risk problems, meaning if a patient is diabetic and they don't feel their feet, we don't want the nails digging into the adjacent skin causing ulceration or wounds. Now, I see a lot of people on YouTube do it one way, but in reality, that's not just how it is. And to be honest, a lot of my videos you see before, I don't spend 20 to 25 minutes in reality when I'm working on nails. That is mainly I guess a theatrical thing for you too. It really takes about 3 to 5 minutes, so don't be surprised if you go to your podiatrist and they don't take 20 to 25 minutes on the nails, getting a curette and digging it all out. I've actually never met a podiatrist that uses a curette, but I try to find a happy medium between the YouTube world and the reality, and I try to make it entertaining for you and try to really get detailed, but I guess my point is it's not necessary. Just smoothing out some of these corners and we'll be done. All right. Much smoother, no jagged edges, not digging into the adjacent toes. Oh man, yeah, no problem. And we'll get one final round up here.
What's going on, everybody? I hope you enjoyed that video. If you did, please click the like and subscribe button with the bell notification so you're notified every time I upload a new video. I also have a martial arts channel that's pretty sweet. You can check out some of the videos here and follow me there as well. Anyway, thanks for watching.